Alrighty folks, so today we're going to go through the items that you received in your nasal seizure kit, and we're going to talk about how to use each of these items so that you can feel confident using them at home. First thing you'll have is a vial of Midazolam. Then you'll have a vial adapter, which will allow you to draw up the medication into a syringe without having to use a needle. You'll have multiple syringes for the multiple different doses that you may need to give, and you'll have a nasal adapter which will allow you to administer the medication. This can be reused and can be flushed with water between uses. For the sake of today's demonstration, we're going to use a vial of sterile water. So I'm going to go ahead and bring that over here and shift this stuff up to the top. So we're going to pretend this is our vial of Midazolam. With your vial, you'll have to pop the green top off to begin for your first dose. Ours is already popped off of this vial. We're going to place the vial adapter on top of the vial and it will snap into place. And then we're going to get one of our syringes. You will have a dose on your seizure kit that is specific to your dog, and you'll want to draw up about as much air in the syringe as the dose would be to prevent the drug being sucked back up into the vial with a vacuum that is created without not putting air in. You'll then place the syringe on the top of your adapter and twist it into place. You'll press the air into the syringe or into the vial, and then you will invert and draw up the amount of drug that you would need. You'll then remove the syringe from the vial, and you'll have your dose in your syringe here. This will then be connected to the nasal adapter so that you're ready to administer it to your pet. Alright, so now that you have your drug drawn up, we're going to use Maggie as our demonstration dog to show you how you would actually administer this medication. She is not a dog that has seizures. She's not currently having a seizure. So she's going to look a little different than your dog may look when you need to do this. They are going to be unconscious and have uncontrollable movements. So we want to make sure first and foremost that everybody's safe, the dog and yourself. So we're going to approach them from behind to do this. And we're going to have made sure that their environment is safe to where they're not going to tangle their legs or potentially hit their head on something. So once you have a safe environment, you're going to stabilize the dog's head and yourself by putting a hand on the side of their head here like this. And you're going to have your drug in the other hand where you will stabilize the palm of your hand on the top of their head. This will allow you to be controlled when trying to give them the medication. Maggie obviously is reactive because she is completely conscious. Your dog, however, not being conscious, will likely not be trying to pull away from the syringe. Once you've stabilized your hand, you will insert into the nose and depress your syringe. If you happen to miss the nose, then you can draw up another dose and you can try again, and this will allow you to administer the drug intranasally.